After listening to both sides of the argument, the plaintiff and both the defendant, they both have valid reasons for doing the action that they've taken, basically. But whether those actions are legal or not, that's the question at hand. Basically, what you have is your plaintiff. Um, your plaintiff does have a patient. Your plaintiff have a patient that, of course, is HIV or AIDS positive, and they live in a general area of the clinic or the dentist. Um, for some unknown reason, well, not, I guess not unknown, but for some reason, the information as far as the patient health got exposed to the general public, in which that is a big no-no in the healthcare profession. Um, the plaintiff wished to keep his clients, information private, which they have they have a right to do that basically. And on the other hand, the defendant, they want to put the information on the folder. Understand, they said there's no names or no social security numbers to identify them with, but basically you can't put um, information like that on a folder, and let alone have that folder stored in an area where it could be seen by other patients and other staff members, basically. Um, that's why in this case, I don't agree with the defendant, but I do agree with the plaintiff that the information should be held confidential and should be private. Now, I have some references from HIPAA and OSHA, basically, and all of these pretty much go stronger towards the defendant. I'm sorry, the plaintiff in the situation. I'm gonna start off with OSHA, basically. OSHA, also known as Occupational Safety and Health Act of 1970, was created by Congress to provide safe and healthful working conditions for workers and everything. OSHA also encourages standards in the workplace by providing training, outreach, education, and assistance. So basically, before I go any further, under OSHA guidelines, uh, AU Bryce Miles should have had training provided by OSHA that would get those guys in compliance to let them know the do's and don'ts as far as storage, storage information, storage of the folders of patient private folders, and not to put that information out there like that. And also, OSHA also covers most private sector employers and their workers. And last but not least about OSHA, OSHA also covers some public sector employers and workers in the 50 states and certain territories. And along with OSHA, there is also HIPAA, which we hear a lot in class about HIPAA. Basically, HIPAA is enforced by the Office for Civil Rights, and HIPAA privacy rule protects the privacy of individual patients' health information. And once HIPAA becomes violated, or once they become a HIPAA violation, I'm sorry, that then that information should be turned over to the Health Information Technology for Economic and Clinical Health. And what happens is this is the organization that handles compliance issues such as violations done by offices that have done HIPAA violations. Now I'm gonna go back to the cases as far as why I agree or don't agree with each one of them. Like I said before, the defendant mentioned that the workers need to know about a disease a patient may have, which that you want to know that, but I mean you should treat each patient as if they had a disease. Be honest with you. What that means is wearing the universal precautions, which would include, of course, the gloves, face mask, to keep body fluids off of you. Basically, to keep the person's body fluids off of you. And by doing that, you treat every patient as if they had something that would relieve your stress of knowing that, okay, I've just been exposed to something with this patient, but that's an issue all by itself, basically. Um, the plaintiff, like I said, the plaintiff lived close to the area, and they wish to keep their information private. So I would favor in the plaintiff because they do have a right to keep the information private, and if HIPAA guidelines and rules and regulations, as long as OSHA were followed, this issue wouldn't even be occurring right now. So basically, that's why I agree with the plaintiff, and thank you very much. Bye.